I have been on a personal quest this past year to document and learn firsthand about the evolution of the health information management profession that's happening right under our noses. I've spoken to friends at AHIMA in the US, CHIMA in Canada, and now I've met with the folks at HIMAA here in Australia. The story is the same. The profession is no longer just about medical billing and coding. It's about data stewardship, patient safety, and of course, AI. I can't wait for you to hear what the Aussies are doing for their HIM profession. Let's get to it. Hello, Colin Hung here in Sydney, Australia, where I have been attending the HIC 2026 conference. And while I was here, the team at HIMAA, the Healthcare Information Management Association of Australia, graciously agreed to join me on camera to talk about the state of HIM in this country and how they are elevating the profession. Here is my conversation with Kathleen and Danika. Well, Danika, Kathleen, welcome to the program. I am super excited to have you both on with me.
Thank you.
Thank you. We can't wait to talk to you.
Yeah.
I am truly excited because I've been on a mission just to try and find out the commonalities and the differences between HIM professionals across different countries. I love the folks at AHIMA in America, CHIMA in Canada, and now I get to talk to you about what's happening here in Australia.
Brilliant. Well, lots of stuff are happening here in Australia. Huge opportunity. But this young lady is a him.
Well, Kathleen, can you, for the benefit of our audience, can you give us a little bit about who you are and your background?
Okay, so I'm currently working for the Professional Association as the Member and Profession Services Manager. So that entails looking at what does a member want. And because I am my own financial member, but I've been a member of HIMAA for a very long time, and I'm a health information manager, I think I'll put a different lens on that. So that's what I'm doing now. But my history in health information management, I started in community health, which is primary care. And I had a manager who said to me, you need to do this degree. And I was like, oh, okay then. So off I went and did the degree. And then I went from there and I did a bit of work in business processes and understanding what should work in an IT department actually. Then I went and worked at corporate health in our state health department in that role and looking at what statewide clinical forms back in the paper realm, and a lot of places are still paper, and also looking at clinical information and understanding how to provide advice to the local areas in that state. Then I left there and I ended up at a very large not-for-profit public-private combination hospital, which then went statewide. So that was a really interesting, and we went from medical records. I think we had about 1.4 million paper records at the time. And then we moved into a scanned medical record. So I did a lot of work in that sort of space and I project managed the rollout to the statewide digitised medical record. And then I went to another smaller hospital, which was a little bit different, and looked after coding, different things like that, privacy, those sorts of things. And now I'm with the association.
And Danika, what about you? What's your background?
My background is all over the place. I've focused for the last 30 odd years with workforce policy, program design across lots of different industries. So IT being one, digital economy, the resources and civil infrastructure, and also a stint as a policy advisor with the federal minister. One of the things I love about this profession is that it's the quiet achiever, it's the superhero that sits across the entire health system. And in Australia, it underpins the $270 billion a year of the Australian health system. And yet, no one knows about us. So one of the things that we're doing is to lift the profile, and of course our friends at AHIMA as well, and CHIMA, we're looking collectively to lift the profile of the profession and get more people in. It's a great opportunity.
I think I found that over the years of talking to the HIM professionals don't get the credit that they're due because of they are in the background by nature. They're doing all the underpinning, as you put it, to support financially and make possible what healthcare organizations do.
Yeah.
But I'm curious to ask you, as you look across the Australian landscape, are there any particular challenges that the profession is facing here that you're helping to address, or that the association's helping them address?
Did you want to take
Yeah,
that?
so I think one of the biggest things that we have is the fact that we've actually got an ageing workforce, which you're working a lot on workforce, and the fact that we have a national shortage of clinical coders and a national shortage of health information managers, even though the health information managers aren't actually recognised nationally as a shortage, we do. And I think the thing is that we are vital to the healthcare system, and we need to do more in how we get more of the profession through. And the other thing is with the clinical coders, we've got a lot of clinical coders come through the diploma, but industry's reticent to put them on because then they're not ready to just hit the ground running. They still need more time before they're autonomous. So then the graduate education task force is something that's happening at the moment.
Yeah, and it's sort of, it's a lot of industries have these challenges with workforce, right? One is creating awareness, two is getting people through the door to be educated and trained, and three is to support them to be employable. And part of that also involves working with industry so they understand what they're getting through the process of education and training. So this is a journey that we're on. I don't think it's something we'll solve immediately, but frankly, the health industry needs us to do this fairly quickly. So with the rapid adoption of technology and electronic health records and some fantastic federal government initiatives that are being rolled out, like Health Connect, we need to make sure that there is a large supply of skills in the workforce to address these rapid changes. At the end of the day, it's about patient safety. And so we recognise that the document, that the record isn't just a matter of data, but it's ensuring that patients are safe and their identification is protected and that our clinicians are able to do what they need to do effectively.
I've always found that HIM professionals have so many hats to wear. When they are the stewards of data quality, or can be, they are, as you said, responsible for, or partly responsible for patient safety. There's, of course, all of the revenue and reimbursement, billing aspect of what people do. There's a lot of different hats to wear for a single individual. So I'm not surprised to hear you say that there's a shortage.
Yeah.
And it takes time to get people up to speed like that. But if you had to identify, is there a particular area that in Australia where there's more attention or focus needed amongst all of the things that HIM professionals do?
Oh, that's a good question.
It is a good question. I'm not sure that there's one particular focus. I think we're continuing to evolve into different areas. So once you move from paper to a scanned digitised record or to an EMR, our roles just morph a little bit to something different. So I think the thing is that we need to be adaptable, and we are adaptable actually because we've been doing it for years. We were discussing that earlier about how it used to be on a card, and then it went from a card to a patient administration system electronically and all those sorts of things. So I think we're a very adaptable profession, and whatever's coming I think will be fine. So I think it's just mainly let's get the workforce right and make sure they've got the right skills.
This is the thing that struck me about this profession. They do so much. They have so much influence over quality of data, ensuring that the governance piece is so important. And that protects not only the HIM workforce, but the hospitals and the institutions that are managing the clinical data. It's so important that it's managed well.
Yeah, and I do think that one of the things that's really important is we always come from a place of how we support the clinician and the patient. And whilst a lot of it has funding implications and all those sorts of things, it really is more from a patient perspective, how are we going to make sure that information's available and readily sourced for the clinician to do what they need to do so that they have better outcomes, really.
Now, right off the top, you mentioned that the HIM profession suffers from a lack of visibility. I don't think if you asked a lot of uni grads that they would go, oh, I know what that was a chosen career that I would have. So what would you say to people who may not be familiar with the HIM profession? What is it that, in your mind, someone in that role does?
I think the biggest thing that we have is because we are a broad brush and we have so many hats, like you said before, Colin, it gives someone the opportunity that if they were to get that degree and go into that profession, if they don't want to do clinical coding, they don't have to. They've got choices. And I think in this generational where people like to change roles and things, our profession is so ideal in that you could start in one thing and then morph in. You could do project management, you could do health promotion, you could go into a data analyst role. There's so many things that we can do, or you can be the broad brush. So I just think the opportunities are so vast.
Danika, what about you? How would you describe an HIM professional to someone who's not in that profession today?
It's the skills that are developed and the knowledge, so the critical thinking that's developed through the education can be applied in so many different areas. You could almost look at the health information management degree program as an opportunity to expand it across the entire health system. Clinical, of course, being quite different, but it's a good launch pad into clinical if you have those skills and ability. But it can be applied in so many different areas, and not all degree programs can offer that opportunity for growth. And I think the demand is not going away. So if you're looking for a long career and great job prospects, it ain't going anywhere. It's a good opportunity.
And we're a fantastic community of professionals that support each other, which I think that is the thing. We're small enough that we can support each other, and we're very good at making sure that everyone is supported.
Well, let's go down that path in terms of support. If you were speaking to the Australian HIM professionals right now, what advice would you give them to help elevate their standing in their own organization right now? Like if they're feeling maybe that they're more behind the scenes, but they maybe shouldn't be, what would you tell them to try and get more visibility?
Keep trying to get a seat at the table. Just keep trying. And also, HIMAA has produced quite a few position statements and the professional identity statement. Circulate that to your executive. Make sure they're aware of what you do. Don't be the quiet one. And some health information managers are more in the introverted space, not all of us. So I think we need an elevator pitch, and we need to make sure that people know we're here and we're important, and we need that seat at the table.
I mean, it's 2026, so I can't do an interview without asking about the impact of AI. What is the impact of AI on the HIM profession in your minds? Have you talked about it? Has there been some concerns about it? Is there an excitement about the technology? What's that been like?
Yeah, I think as it relates to health information managers, HIMs are more essential in the world of AI. So as you say, quality data in, quality data out, but there's a whole governance framework around this. And you can't remove the specialty of a HIM in that process. I think there's going to be more demand for health information managers in that world. Yeah.
And I think too, from an AI, the buzz is around clinical coding, of course. And HIMAA produced a guideline to AI and clinical coding last year, the Australian guideline. So that provided some framework and some best practice type items to help people when they're looking at vendors and things like that. But I do think that it's going to be a time before AI takes over clinical coding. And I would never say takes over, as it's just like when you go from a scanned medical record to an electronic medical record, those roles morph and change. The clinical coder, the manager's roles will morph and change, but their expertise will still be required.
I've heard many times, for example, that yes, we're many years away from it being fully automated. And until then, a lot of the training, that way the HIM professional can handle the exceptions, and AI maybe can handle the mundane, which no one likes to handle anyway. So there's, in a sense, AI can help an HIM person practice at the top of their profession, right? To deal with all the more complex cases. Yeah. And we know the rules change every day. So there's, as you said, no shortage of job security for someone in this role. let's turn our attention internationally for a moment. I mean, I have been on a tour of, like I said, AHIMA and CHIMA. How are you collaborating with other international associations or other HIM professionals from other jurisdictions, whether that be Asia or in North America? What are you doing? What are some of the work you're doing there?
Yeah, we're close friends and partners with AHIMA and with CHIMA as well. And part of our collaboration is to understand what's happening in each market. We share best practice and ideas. We collaborate as much as we can on programs. And it's partly because, we appreciate that the workforce is a mobile workforce too. So whilst there are differences with standards used in different markets, there's a lot of ways that we can collaborate and really learn better ways to attract workforce and collaborate with workforce and support the workforce. So it's very important that we continue this momentum.
Yeah. Yeah, and we've got a delegate for IFHIMA, the international. We held the International Congress here about 3 years ago in Queensland. There's lots of things, lots of collaboration, and I'm pretty sure, was it Hong Kong that recently formed, one of the Asian countries recently formed an association, Health Information Management Association, and our CEO met with them when they were visiting. So there's lots of tentacles happening, and I think there'll be more.
If I come back here 5 years from now, sit down here and chat with you, what will you tell me that will show to me that you've been successful in your vision and your work? What will we be talking about 5 years from now?
I think we'll have more universities delivering the bachelor's and master's program. We will have a seat at the table with policy development at federal and state and territory levels. We will have an evolving clinical coding workforce that understands its purpose and opportunity.
Mm-hmm.
And I think it's just greater familiarity of the profession. Yeah.
Kathleen, what about you? What will we be talking about 5 years from now?
I'd like to think in 5 years that the things that Dan said are definitely going to happen, but I think also we'll still have that solid community, and we will have a professional body that is still proactively advocating for the profession and finding those items that need to be advocated for and moving forward, always in a forward manner.
Excellent. Will we be through the EMR implementations that are hopefully going to be happening here in Australia in that time?
Well, that is a bit of a red herring, Colin. Considering that I think Queensland still has some to finish off, and they started a very long time ago. And the single digital patient record's rolling out in New South Wales. I don't know how long that'll take. And Victoria's got different things, and WA's got it on the table. So 5 years, maybe.
I think every country, Canada as well, we've been talking about this forever, and we're still, I think, 20 years into a 5-year journey.
Yeah,
that's kind of how it
20 years
goes.
into a 5-year journey. I love that.
Well, you guys have been great on the program. Where can people go to learn more about the association?
Well, we'd love you to come to our website.
www.himaa.org.au.
Excellent. Well, thank you so much for taking time out of your busy day here at the conference to talk to me.
Thank you so much.
Thanks, Colin. It was a pleasure.
Good to see you.
Hey, I really want to thank Danika and Kathleen for joining me on the spur of the moment to educate me on HIM in Australia. I'm convinced, by the way, that HIM professionals are some of the most friendliest people in healthcare that you'll ever have the chance to meet. And I really loved what HIMA is doing with the local universities to ensure that young people are aware of the HIM profession and potentially to convince some of them to take the leap and join this wonderful industry. It was also really nice to hear how the team at HIMA also collaborates with folks internationally like AHIMA in the United States and CHIMA in Canada. I think we can all learn from each other. Now, if you've made it this far in the video, we would really appreciate it if you mash that like button and click subscribe. I'm Colin Hung here in Sydney, Australia. Thanks for watching, and I'll catch you on the next video.